Hi, my name is Dr. Jim, and today I'm going to be talking about motor vehicle collisions and whiplash injuries. So the most common motor vehicle collisions are rear end collisions. So with that in mind, I'm going to talk to you guys about mechanics and how injuries can occur in a motor vehicle collision. Injuries are going to vary from person to person, but most commonly they're going to affect the neck, the upper back, the lower back, extremities such as the shoulder, the wrist, the ankle, and you're also going to have headaches as well too. So neck pain occurs when you are hit from the rear and that causes your body to go forward. And when your body goes forward with the car, your neck doesn't, it hyperextends. So when it hyperextends, that's going to cause pain. And when the car halts or the body halts, what happens is your neck goes forward. And that causes a hyperflexion. And both of those are going to cause you to have neck pain. So another thing that is common with this is that your brain gets squished, hits the back and the front of your skull, and that can cause mild traumatic brain injury or what's called concussion. And some of those symptoms can include loss of consciousness, fatigue, brain fog, and also difficulty with just concentrating, among many other symptoms. So now the shoulder harness is great in that it keeps you from flying out the window in a major car accident or rollover. However, with the shoulder harness, what it doesn't do is it doesn't protect your neck. So your body is clamped against your seat, but your neck is still freely moving, and that's where a lot of injuries occur because the neck is just moving back and forth in what's called a whiplash injury. So another thing that the shoulder harness can cause is chest pain because of that restraint that goes across your chest. A lot of cars, when you get into a car accident, the chest restraint will tighten up and it's not going to move, and a lot of people are going to get chest pain from that and even shoulder pain from that. So in a rear end collision, what happens is a lot of your spine in your upper, your mid, and your lower back is compressed. It's compressed from the seat from behind and from the shoulder harness in front, as well as the lap belt. So all of that compresses your spine, and with that, the jolting movement of the collision all can cause injury to those areas. So with extremities such as your shoulder, your elbow, and your wrist, what happens is you're holding onto the steering wheel, and when you get hit from behind, they compress into your body, and that can cause injuries to all these areas. And then with your lower extremities, such as your knee and your ankle, what happens is the knee can hit the dashboard, that can cause injury to those. And your ankle, a lot of times you're pressing on that brake pedal, that can cause a hyperextension of your ankle joint, and that's going to cause either spring strain or misalignment of the joints down there as well too. Now all of these can cause injury to muscles, ligaments, joints, and nerves through compressive forces and shearing forces of the collision. And all this can also lead to tearing of muscles and ligaments, which is going to lead to pain. So if you're ever in a car accident, there's some things that you be aware of and remember to try to do. So first thing you want to do is call 911. Second thing is exchange information with the person that was involved in the motor vehicle collision with you. Third thing is take pictures of damages. The fourth thing is call your insurance company and get a claim number. And then the fifth thing is seek medical care. So make sure when you're seeking medical care, make sure you go to someone who understands the biomechanics of a motor vehicle collision and the injuries, so that they can properly treat you and you can get better in a shorter amount of time. So thank you for your time. My name is Dr. Jim, and I'll see you at the next episode.